Hello, friends. Now we'll be beginning our discussion on MSK radiology. And first, we'll be talking about MRI of knee. Now, in this particular session, we'll be talking about the basic muscular framework around the knee joint, which we need to remember as radiologists while we're reporting a case of MRI of knee. So we'll be looking at a number of cases of MR and we'll be looking at a few cases of CT to understand the basic muscular framework around the knee joint that we should be aware of while reporting a case of MRI. So let's start our discussion straight away. So before we go ahead, I want you to have a look at this particular video. Now, this video shows you the muscular framework around the knee joint. So what I'm doing here first is, first of all, I'm removing the skin and the subcutaneous fat out of the knee joint. And here you see, I can see some muscles which are located along the anterior aspect of the knee joint. Now I'm rotating it. First, we're looking at the medial aspect, then we're looking at the posterior aspect, and then we are again rotating in such a way that finally we have the lateral aspect to end at the anterior aspect all over again. Now what I'm doing is I'm removing few other muscles from the superficial compartment so as to have a better look at the deeper compartment muscles. What do we see? I just don't want you to make any assumptions right now. I just want you to enjoy the beauty of the muscular framework right now, okay? So again, I've rotated it in one full circle, and I hope all of you would have made some major observations. Now I've removed all the muscles around the knee joint. On all what you see is nothing but a broad framework of bones. So let's start it once again. Now let's try to analyze the various muscles as we see. So when I'm just removing the skin and the subcutaneous tissues anteriorly, what can I look at? I have a bone here, and I hope all of you know that this bone is patella. I have a muscle which is located here, which is located superiorly to patella. Then there is some muscle which is coming down, and it is attaching to the tibial tuberosity. I can also see a very big fleshy muscle along the medial aspect of the lower thigh, which is attaching somehow to the patella. These are the two basic muscles that I can see when I'm looking at the projection of knee from the enteromedial view. Right? I hope everybody of you would be able to appreciate all of them. Now, let's look at the video further. Let's move ahead. Now, as we turn posteromedially, that is here, what do we see? I hope everybody of you would be able to see that there are a number of tendons that we can see. First of all, I have this one here. Then I have a tendon which is located here. Then I have a tendon which is located here. Okay. And all these three tendons, now these three tendons which I am looking at along the posteromedial aspect of the knee joint, I can also make a very striking observation that all of them are attaching on tibia. That means they're basically crossing the joint and then they're attaching on tibia. I think that's clear. Now, I just want you to look at these cases. I don't want you to remember anything. Just enjoy this particular representation, and then we're trying to decipher what we can see around. Now, let's move this image a bit further. And when we move posteriorly, what do we see? When we move posteriorly, now I can see that there is a very big, strong, fleshy tendon here. You can just ignore these. These are nothing but these are the blood vessels. This is a fleshy muscle which is located along the posterior aspect of the knee joint, more so along the posteromedial aspect. And I can also see a muscle which is now forming a part of the posterolateral compartment of the knee joint as well. Both of these muscles again are crossing the knee joint to go and insert over the tibia, or in this particular case, perhaps in the region of fibula, that we'll see once we rotate this particular image a bit further. So let's clear this up and let's move our cursor a bit along the lateral aspect. Now, what do we see on the lateral aspect? On the lateral aspect, again, I hope you can see that there is a tendon, a muscle that we looked from the posterior aspect, but now it's well seen on the lateral aspect, which is inserting somewhere in the region of the head of the fibula. And this, to a certain extent, gives us a broad anatomical framework of the various muscles which are located along the knee joint. We still don't know their names, we don't know where they originate from, we don't know their insertion, but still, by looking just at this particular examples, we have made a discovery. When we look at the posterior aspect of the knee joint, there are three tendons which are located along the posterior medial aspect. Then we have a big fleshy tendon, a big fleshy muscle here, which is located again on the posterior medial aspect. And we again have a fleshy muscle here, which gets inserted over the region of the head of the tibia, which is located along the lateral aspect of the knee joint when you look at it posteriorly. Now, let us continue our discovery further. Just clear this up. Now, what I'm doing is I'm removing the superficial group of muscles, and now we'll have a look at the deeper group. Okay, so now we look left with a deeper group. Now let us move it posteriorly. So even if I remove the superficial group of muscles, I can still see the three tendons that we talked about. One tendon is here, one tendon is here, one of the muscles is here. Probably its tendon was somewhere here, which we could see previously, but since I've removed the superficial musculature, it's not well seen. Then when we are going further posteriorly, now what can we see? We can clearly see that there are certain tendons which are present along the posterior aspect of the knee joint, which are coursing from the level of the lower end of the femur further down into the calf. What are these muscles or tendons? We can see that these are these two group of muscles, which are not only encasing this popliteal fossa, but they're further going down into the calf as well. Some of you might ask, sir, what is this particular muscle? It is looking like a muscle to me, but no, it is not muscle. It is another very, very important anatomical structure which is seen in popliteal fossa, something that we image by color Doppler. Yes, it is nothing but this is the popliteal vessels. Popliteal vessels. So now we know a lot of things about the different muscles which we can see around the knee joint, but we still don't know their names. And when I'm moving it further along the lateral aspect, along the lateral compartment, I hope now everyone would be able to see this particular tendon quite clearly, which was inserting over the head of the fibula. So in this particular session, we'll be looking at all these muscles, we'll be looking at all these tendons and their relationships with each other as well as with the knee joint. But to begin with, I hope everybody of you would now at least have a basic framework of the different muscular groups that we can expect when we're going to discuss the MRI of the knee joint in cross section.